Hello, on behalf of CME Outfitters, I'd like to welcome you and thank you for joining us for this CMEO snack titled Adapting and Adjusting Best Practices for Utilizing Telehealth in Osteoarthritis Management. My name is Jason Wilcox, orthopedic surgeon in Seattle, specializing in sports medicine. And prior to March of this past year, I don't think I would have had anything to say about telehealth, but all of us have been thrust into this new world. Our learning objective today is to apply strategies to manage osteoarthritis during the COVID-19 pandemic. Now, what is osteoarthritis and why does it matter? It's the most common form of arthritis. It affects up to 1 in 3 people over the age of 65. It is the third most rapidly rising cause of disability. It represented 10% of all clinic visits last year across all specialties. It's the most common reason for a decrease in ambulation. And hip and knee osteoarthritis is the highest risk for all cause, as well as cardiovascular related death. Concomitant osteoarthritis has been known to lead to higher risk of diabetic complications and those suffering from diabetes. And from a financial standpoint, it cost $128 billion in 2003, which was 1.2% of the GDP at that point, and it certainly has not gone down in the last 18 years. If you saw part one of this talk, you'll have seen this slide before. We look at osteoarthritis in terms of things we can change and things we can't, as well as more local factors affecting the joint itself, or more systemic factors that may affect multiple joints or the rest of your system. And why does this matter? When you look at what the predicted probability of difficulty walking for a 60-year-old female would be, with no health problems, moving into diabetes or heart disease, osteoarthritis, or all of those combined, you see a progressive cycle of difficulty with ambulation, and given its negative effect on diabetes and other health-related problems, it becomes of critical importance with an aging population. Now, what does this have to do with telemedicine? At least in my world, it had nothing to do with telemedicine until fairly recently. In mid-March, the Surgeon General recommended cancellation of all elective surgeries, and that certainly fit with total joint replacement, particularly as early in the pandemic as well as now. The older the patient was and the higher chance of having comorbidities became the highest risk of both getting COVID-19 as well as having a negative outcome from COVID-19. And as such, it affected this population disproportionately to the rest of our patients. There was a study done at 6 centers looking at 360 patients that were canceled during that time alone. Estimated 150,000 total joint arthroplasties were canceled nationwide. In discussing it with these people regarding severity of their disease, even at the early time of COVID-19, when ICUs were filling and horrible stories were coming out about the news, 30% of these people would have had their surgery despite the risk of them contracting COVID-19. I think this suggests how severe osteoarthritis is in affecting people's lives, that they would actually be willing to subject themselves to a potentially deadly disease in order to get pain relief. 15% of this population reported no help at home, which not only affects them if they had surgery, but it also tells what kind of problems they're in if they cannot get adequate treatment. Now, telemedicine has been a bigger part of our lives, certainly since COVID-19, but it had been growing prior to that. Its origins go back to the late 19th century, shortly after wires were put in, going along with train tracks. The use of telemedicine has been increasing since that time. It's been very slow up until recently, though. Even though 20% of employers covered telehealth visits in 2015, it was up to 82% in 2019. During that time, only 2.4% of employees used telehealth visit in 2018. And it was a little under 10% in 2019. Now, we don't have data from 2020, or at least that I'm aware of, but I would assure you that it has gone up since that time. There's been increased interest from insurance companies, health systems, large tech companies, and even here locally in our own office, telemedicine use has gone up as both the patients and the physicians seem to get some benefit from it. The benefits of telemedicine are quite simple. You just have to ask your patients. They all love it. Being able to have your appointment either in your own house or at the office or on your lunch break is certainly easier than trying to navigate to come, especially to a downtown clinic like what we have, or dealing with parking or even taking off the additional time it would take to come down here. On studies related to this, they can have up to a 99% satisfaction with telehealth. And in fact, 86% of people prefer telehealth to a traditional in-person visit. There are studies suggesting that it's actually cost benefit both to the patient as well as to the provider. There's a Finnish study suggesting 45% savings across the board compared to a traditional visit. And an Argentinian study found between 12 and 72% cost reduction. There are studies suggesting that it is both efficacious and accurate, showing that a traditional patient seen in the clinic and those seen via telehealth had a similar rate of conversion for a procedure, as well as satisfaction with the appointments were seen to be high in both patients and providers. The difficulty is also very clear. It was clearer early than it is now. Technological literacy is probably the biggest issue, especially for an aging population. Though in my own personal experience, it's been interesting to see how everyone's ability to use FaceTime or Team or Zoom or any of the other options have continued to increase and seems to be easier and easier with time. Implementation and cost, it's another issue. Now, currently there's some waivers from the government regarding HIPAA compliant platforms. And as such, a lot of these options are currently free. Now, as more government regulation comes into this, we'll see if that holds. Efficiencies is another problem. When done correctly, this is incredibly efficient. However, between technological challenges, difficulties with internet connections, as well as blocking out specific time, this can get a little bit harder. One of the biggest problems, at least in an orthopedic office and likely any other office treating musculoskeletal injuries, would be the inability to perform an exam. There's still some value, of course, in actually being able to put your hands on the knee, on the hip, move the joint around, testing for laxity. There are certain things that cannot be reproduced over the course of a video camera. There's also financial implications now. During the public health crisis, most of these regulations were waived or put on hold, and that you would be reimbursed at a similar rate to what you would see a patient in clinic, and they would be charged accordingly. Prior to this pandemic, and there's some question about going forward as to whether this will hold. And in that case, if the patient is either not covered by telehealth visit or if the provider is not going to be reimbursed for the same amount of time, you could see the adoption of this technology slow down once again. Now, as technology has moved on, we're seeing advancements in one of the challenges for this, and specifically with respect to on the physical exam. If proper preparation is done ahead of time, the patient can be appropriately dressed like this person wearing shorts. There's also online tools such as this goniometer that you're seeing on the knee, and these can allow you to evaluate for hyperextension, internal and external rotation of the hips. We can look at gait, look for erythema, range of motion, and actually measure these things fairly accurately. The one limitation, of course, is still the inability to palpate or potentially understand true instability, especially as it relates to knee and other joints where we see that quite often. Tips in going forward is get to know your technology. I certainly remember the first several Zoom calls that I had done and the difficulty in sharing the screen or moving through images. As you get to know your technology and use it more and run through several practice attempts, it gets easier and easier. If you schedule appointments without distraction, such that people know when the door is closed, that's just like any other clinic visit, or you don't have your kids running around in the background. Although from my own end, seeing somebody's dog run across the screen provides a welcome break to my otherwise day in clinic on occasion. Reinforcing pauses, both in their own life as well as what you're seeing on your exam, seeing progress. You can still form a lot of the same relationships with the patient via Zoom as you could in clinic. Also using other resources. Just coming into a visit blind, not having some of the other tools available to you, either by getting imaging in advance or letting them know what the visit will look like or how to prepare for the visit, can reduce the effectiveness of the clinic visit itself. The other part is integrate self-help and activities, especially with musculoskeletal disorders, and especially if you've seen the part one of this talk. Getting people moving again is key to their health, and defining things that they can and can't do. And one of the benefits, of course, of telehealth is oftentimes they're doing it in their own home, and you get to see the setup they have for either an exercise bike or a weight room or what their outdoor activities may look like. And that is certainly a benefit that we have with telehealth compared to a sustainable clinic visit. Again, if you saw part one of this talk, you'll see SMART goals, which is an acronym used to evaluate osteoarthritis. Specific one, you want to maximize mobility in the time of isolation. When you look at particularly this population, which is elderly, less mobile, and oftentimes even more isolated now as they weren't able to interact with their family, the difficulty with mobility during this time is even more so than it probably was a year or two ago. And in that setting, trying to figure out how we can get them moving again, as per the previous talk, looking at physical strength, joint motion, ambulation, et cetera, is known to increase satisfaction with both their joint as well as their life in general. Measurable, increasing our abilities with video, such as the goniometer seen above, as well as certain wearable tech. There's companies coming out with mobile technology that allows you to use bracing to see if a person is in fact moving their knee, how many steps they're taking, how much time they're spent exercising, et cetera. All of these things can give you more data points than what we were probably traditionally using. Attainable is an important part of the equation. The first step is always understanding the problem, understanding what they're wanting to do. Again, if the person is wanting to walk to the mailbox or wanting to play tennis, deciding if those goals are realistic or unrealistic, and then determining which treatment option best suits them. Relevant, I think you're seeing this become more and more relevant, as in the earlier slide. The cost burden of osteoarthritis is incredible, and it seems to be increasing as the percentage of the population above the age of 60 continues to increase. Timely attainment of these goals. I mean, the issue with the problem is now, even though it looks like we're coming towards maybe the end or nearing the end of this public health crisis, some of the problems that it revealed or even brought to the forefront is still an issue. And as such, adopting newer technologies may help us treat these patients in a more expedient manner. If you have any interest in adopting telemedicine into your practice, these are some websites that can give you information regarding guidelines from both local and federal level, as well as reimbursement practices and policies that may help you implement these into your own practice. I'd like to thank you again for joining me for this CME snack. I hope the telehealth strategies that we've shared with you today give you something to consider regarding remote assessment and management of your patients with osteoarthritis. Click on the link and it'll take you to the post-test and evaluation. You'll be able to print your CME certificate immediately afterwards. Thank you again.